are some of the signs of healing the fallopian tubes? Some of the things you may see when healing the scar tissue in your fallopian tubes include quick, sharp pains or twinges, or some slight tugging or pulling in the pelvic area. Or you may see mysterious tissue or flesh-looking objects in the toilet after you urinate. Okay, so listen up. I am a scientist at heart, just not on paper. I find it quite fascinating to witness the physical and visual effects of the body healing itself. It is rewarding. So when you feel these mild pains here and there, or see these mysterious objects in your urine, embrace it and be happy that you are doing something exceptional for your body and your health. The healing components in the fallopian tube formula system work together to eliminate inflammation and break down this scar tissue and adhesions, allowing the body to replace this scar tissue with new healthy cells and tissue. So how does scar tissue get broken down or used by the body? Once released into the body via the bloodstream, the therapies and supplements in the fallopian tube formula system promote the degradation or breaking down of cellular debris of scar tissue or adhesions and cause fluid accumulations to become thinner, thereby facilitating the drainage of harmful substances away from the site of inflammation. Now, these harmful proteins have been broken down into smaller components, peptides and amino acids, that the body can now use. Any other residue that is not used is excreted in the usual manner via the excretory system, in this case, the kidneys. The excretory system is a system of organs that removes waste products from the body. So blood carries these waste products to the kidneys via the renal artery. The cells in the kidneys, called nephrons, take in the liquid portion of the blood and filter out impurities such as urea, mineral salts, and other toxins or residues, and the urine then carries these products out of the kidneys. Therefore, during the healing process, this can appear in your urine as mucus threads. Now, they may be white or even blood tinged. In fact, I might do a photo collage showing this phenomenon in another video. Some people worry because they may not see these mucus threads, and I have found that it's actually more common not to see it, okay? A couple theories arise, and I'll tell you now. The reason some people may not see these mucus threads in their urine could be that their body was able to use all of the proteins in the form of amino acids and peptides. Or maybe their body is in great need of these amino acids and peptides, so the body uses it all and expels none. Or perhaps the person has a more minor case of scar tissue or adhesions. Another possibility is that their dosage or treatment plan is at a more moderate pace than others. And yet another theory is that it's coming out of you, but you are not paying attention and throwing toilet tissue on top of it or flushing too soon to look. And whatever the case may be, whether you see this in your urine or not, it is vitally important that you trust in the process. Many women have healed their fallopian tubes and never saw an inkling of this mucus in their urine, okay? So just continue to remain consistent in your treatment plan and go with the flow. Pardon the pun. And as I said earlier, I cannot guarantee that every woman who implements this system will be healed and go on to have the baby of their dreams. I wish I could. All I can do is give you the tools that your body will need to attempt to undergo this task. And now, I have witnessed many of my clients heal their fallopian tubes using these techniques, and some easier than others. But I have found that those who heal completely tend to be those willing to make whatever changes necessary to make the healing process successful. These women were also very consistent with their therapies, implementing as many of them as possible and continuing to do them for as long as it took. Those who want to heal on their own terms, only doing one of the therapies or only for a short time, may not have complete healing. Also, please keep in mind that the body heals in order of importance and priority. So if you have an underlying health condition such as an autoimmune disease, arterial plaque, or adhesions or inflammation in an organ that's necessary for survival, Your body will always choose self-survival before reproduction. This is the way the intelligent body was designed. It will choose to preserve your life before it goes to work on creating another life. If this is the case, just be patient with your body and trust that it is healing you as quickly as it is capable. It is healing you right now, and it will get to your fallopian tubes just as soon as it can. Remember, this is holistic healing, the healing of the whole body and self. It takes discipline and it takes courage. You cannot give up when things get a little rough. Keep in mind, we often feel the urge to quit right when we are about to hit the proverbial finish line. Don't quit. Relax, breathe, and just stay on track.